Americans still come to terms with the attack on the U.S. Capitol a couple days ago now, we want to start by focusing in on the other crisis in this country, COVID-19.
Two numbers really tell the story right now. 4,110 is the first one. That's how many deaths were confirmed yesterday alone, the deadliest day so far in the pandemic. We also broke the record in terms of new cases in a single day.
And here's another number for you, 140,000. That's how many jobs we lost in this country in December, the first monthly drop since the spring. And joining us to talk about these two emergencies are two great guests. Dr. Thomas Russo is Chief of Infectious Diseases at UB, and Mark Hamrick is Senior Economic Analyst with bankrate-dot-com. We thank both of you for your time tonight.
Dr. Russo, we're going to start with you here, and there is a bit of breaking news that I want to ask you about in terms of the medical side of the pandemic. NBC News has obtained a document from the White House Coronavirus Task Force, and it says there is this new variant of the virus that has evolved here in the U.S. So this isn't the British strain we've been talking about, but it is in this country, and the experts are saying that this is driving some of the new spread. It may be 50% more transmissible. Can you give me your reaction to this, and should people be concerned about this, especially in context of the fact that we just had 4,000 plus deaths?
Well, details are sparse about this possible variant that's independent of the others that we've heard about that have been described in Europe and elsewhere. And I think here are the key things for people to remember about these variants, because the coronavirus is going to mutate and we're going to get different strains. And the key questions is, first, are these strains more infectious? And is a possibility that these new variants may be, and they could be fueling spread. But I think the critical aspects of this are they don't seem to be causing more severe disease, and that's obviously good. Likewise, it's predicted our vaccinations should work against these strains, at least for what we know right now, because the vaccine will generate antibodies against multiple parts of the virus, and these variants usually have a limited number of changes. But if you have a strain that's more infectious and more transmittable, it's critical that we employ public health measures and protect ourselves. Masks and distancing will work. And if we do have strains that are circulating that are more infectious, we need to increase our rigor with mask usage, distancing, and avoid those risky situations to keep this situation under control.
Mark, over to you. Economists were predicting 50,000 new jobs in December. Not much, but we went in the wrong direction again, losing 140,000 jobs. Were you surprised by the jobs report this morning, and what's your key takeaway from it?
No, I wasn't surprised because I thought there was a risk that we'd have a negative number here. When you're talking about the magnitude of the job market, basically a miss is relevant more for Wall Street than it is for us. And obviously, to the extent that we didn't even get that level of slight job gains is disappointing. But even contained within this number, we had nearly 500,000 jobs lost in this single month in leisure and hospitality nationwide. So that's the bar and restaurant and travel related realm. And you're talking about a lot of numbers there at the outset of this, most of which are heartbreaking. Here's another heartbreaking one for you. More than 9 million jobs were lost in the year 2020. We've never lost that many jobs before. We have reason for hope. We know vaccines are going to get us out of this mess. Obviously, there are all kinds of health measures the doctor knows so much more about. But the cause of the downturn is the pandemic. And so as we get those vaccines administered, hopefully sooner rather than later, we get these other vaccinations for the economy, the economic relief legislation that was signed December 27th, as well as what the new president and the new House and Senate hope to deliver. I think that will get us to a better place. But there is going to be long-term loss from this, deaths of businesses, so to speak, and long-term unemployment. So even though we'll get to a better place, there are going to be scars from this in the economy.
Yeah, and sooner the better. And that's exactly what we want to talk to you about, Dr. Russo, is the vaccine rollout. The big news today is that starting Monday, teachers, first responders, transit workers, and those 75 and older will be able to schedule their vaccinations here in New York State. So that doesn't mean it's going to happen quickly for those people. Supply is still very limited here. But all things considered, knowing how important it is to get everyone vaccinated, how are things going so far as administering the vaccine across the country and the state and here in our region?
Well, we had a little bit of a slow start, as everyone knows, and I think that was due in part because it was a new process. And also it was over the holidays. And so the timing was really less than optimal. But we've really picked up our pace this last week, and we're getting a lot more vaccines into the arms of individuals. I want to give a tip of the hat to our local VA hospital, which was the leading hospital in vaccinating individuals in their VA visit. And ECMC is doing a great job as well. And they've been using all of their vaccine, which is one of the goals of the governor, that we get all of those vaccines used every week. So I think we're accelerating our pace. We're getting the people vaccinated that we need to get vaccinated. And I'm hopeful, I'm an optimist that we're going to get this done and get back on the schedule that we were hoping for earlier.
Mark, let me ask you, when we look at why we lost 140,000 jobs last month, you mentioned this, some industries were especially hard hit. Want to share some of those specific numbers? So restaurants and bars, 372,000 job losses. Casinos and recreation lost 92,000. Hotels and accommodation also down. Is this just more proof that the fundamentals of the economy are probably okay? It's really these industries that are directly tied to the pandemic that are continuing to suffer. And if that's the case, does that mean that we can have a quicker recovery out of this?
Yeah, sure. I mean, the virus is the cause of the downturn, and getting away from the virus will help to cure many of these economic ills. But for example, also last year we had more than 1 million jobs lost in state and local governments. So, this is why many feel it's very important to get money out to those governments, by the way, to public health departments, as well as to first responders, schools, and other important parts of our government. So, Michael, I do think that we can have a great rolling reopening in the economy in 2021, but we're in this tunnel that has light at the end of it right now. We need to get through that tunnel, and right now are the dark days of winter in so many different ways.
Yeah, absolutely. And doctor, we were warned that things could get worse with people traveling so much over the holidays. At least as we look at the entire country right now as a whole, do you think that we're seeing the consequence of that? And if so, how long until the infections, the hospitalizations, and the deaths maybe can start going down? Because right now the trends are not good.
Yeah, I think January is going to be a tough month, Michael. As you know, hospitalizations tend to lag a week or so from new cases, and deaths a couple of weeks after that. And the curves are continuing to go up. The good news is we're doing a little bit better here in Erie County than some parts of the country. But we have far too many cases, so this is the time now when I think, we need to take our public health measures seriously, because we're still several months away from getting the vaccine into enough individuals for the vaccinations to make a significant impact. Where the holiday events are behind us. We've got the Bills games coming up. Hopefully that won't cause us a bump. Everyone, please behave in your homes and be good. But January might prove to be a tough month. We're just going to have to see how the numbers play out.
And finally, Mark, we're almost out of time. So quickly, stimulus checks have been going out. A lot of families have already gotten theirs, up to $2,400 for a family of 4. Democrats say they'll pass even more stimulus soon. But how quickly can that really get into the economy and make a difference on a macro level?
Well, the new checks, in terms of the ones that were the result of the legislation passed December 27th, have gone out beginning almost immediately, many of those electronic payments. So I would say as soon as Congress and the president, presumably President Biden, will be the one signing that legislation, as soon as they do that and they want to put the money into the system, it will happen.
Dr. Thomas Russo with UB and Mark Hamrick with bankrate.com. Mark, hold up your hat for us. Mark is in the D.C. area, but he's a Bills fan. He lived here for a while, as you may know from a previous show. So we'll end with Go Bills, something we can all agree on.
Go Bills.
His
Thank you,
heart's here
gentlemen.
in Buffalo, that's for sure.